Thank you. Welcome to our third of the series this year. We have 6 total. There will be 3 more this spring. I'm Debbie Bray, the Associate Dean for Research and Health Sciences, for any of you that don't know who I am. And these symposiums every year are really fun to bring students out as well as the faculty to see what we all do. If there are collaborative efforts that can be made, as well as are there different projects that people might be interested in working on from different areas. So thanks for being here today. Thanks for being part of the symposium series that we do. So I'm going to introduce our 2 individuals presenting today, Dr. James Petrovich and Dr. Twis, both from social work, will be presenting their work. So I'm going to let y'all just go ahead and take it away.
Thank you, Dr. Ray. Good afternoon, everybody. Happy Friday as well. Okay. So as Dr. Ray mentioned, my name is James Petrovich. I'm an associate professor in the Department of Social Work here at TCU, and one of the investigators on the project we're going to present to y'all today. Just a little bit about me, just a little bit is my main area of research is homelessness, just the broad social problem of homelessness. More specifically, though, I do tend to look at the unsheltered population, and so these are the folks who sleep under the bridges and in the camps. Are also often called rough sleepers. That's a term that's used to describe that population. I think they use that in the UK a lot. I saw you nodding. Yep. So you were a rough sleeper. You've come a long way. Also, another area of interest of mine is program evaluation, and the project we're going to present to you today. There's some aspects to it that definitely are program evaluation related, and so that's something I like to try and do for local agencies in the area, especially those that are serving people experiencing homelessness.
And as Dr. Petrovich said, he works on homelessness, and it looks from this part of the slide that I don't really work on homelessness, right? This is domestic minor sex trafficking, and that is my primary area of research. However, there's a lot of overlap between the issue of human trafficking and homelessness. And so when I talk about looking at domestic minor sex trafficking risk, we know that one of the major predictors of entry into commercial sexual exploitation of children is homelessness or runaway youth. And so that's where the overlap is here on this research project, where we look at homelessness and how to improve trainings for homeless service providers.
So we're just going to talk to kind of frame the problem for you, and that means all right. So homelessness in Tarrant County, it's about just a little over 2,000 people on any given night are found to be experiencing homelessness, and so that could be sleeping in an emergency shelter or rough sleeping, which again is sleeping outside. The majority of them, though, do sleep inside. They sleep in an emergency shelter, and some of you may know some agencies in the area. Presbyterian Night Shelter, Gospel Mission, Safe Haven of Tarrant County is a shelter that serves victims of domestic and interpersonal violence, and so that's another agency that kind of falls within the continuum. People experiencing homelessness are most often male, smaller proportion are female, and this is, our statistics, at least in terms of gender, are consistent with what we see across the country. About 15% are under the age of 18, and most of those are folks that are family groups. So very, very few unaccompanied minors on the street, but they are out there. But most children who are experiencing homelessness are with a parent or a caregiver or guardian of some kind or another. Just a little note is the 560 sleeping outside actually pretty much doubled from the year before. And so Fort Worth is kind of grappling with a growing issue of homelessness. We're also struggling with a lack of affordable housing, which is, of course, an immediate response to homelessness. And then also we're struggling in terms of some of the supportive services that this population often needs, such as mental health care services, health care services, employment services, basically any kind of social problem you can think of can oftentimes lead to homelessness, including runaway youth and things like that. We did this project for the Tarrant County Homeless Coalition. They approached me and said, we provide these trainings in the community every year. We're touching a lot of people and a lot of different agencies, doing a lot of different things. And would you be willing to go in and evaluate or just gather data about these trainings that we're doing to see if what we're doing is actually working? And so the mission of the Tarrant County Homeless Coalition, or kind of their goal in the community, is to lead the community solution to homelessness in Greater Parker and Tarrant County by serving as a catalyst for community transformation. And the way they do that in practice, and to contextualize the Tarrant County Homeless Coalition and also thinking about the larger community response to homelessness, I have this wonderful diagram, which I took off the TCHC website. Our study specifically looked at trainings provided by TCHC and the work environments that assistance workers serving this population work in. And that's really represented in this graphic by this little area right here. So we, Tarrant County Homeless Coalition is what we call the continuum care lead agency for our area. And that's a federally defined role. And so what they do is they serve as a pass-through for federal funding. And this federal funding goes to prevention, it goes to diversion, it goes to outreach, it goes to shelter, and various types of supportive housing. So TCHC is a huge part of the homelessness response in our community. $15 million, that's the largest kind of single grant this community receives for homelessness. And so what's done with that obviously impacts a lot. But as you'll notice, this really is it's an ecology. And so in the midst of these formal providers, we also have other systems that we're working with to serve this population. We also have, at the top, stakeholders. We have folks not associated as formal service providers or involved in these other systems. So it's the faith community, it's your general citizen, the general populace, and how they deal with, how they perceive and respond to homelessness themselves. Business community is very involved in addressing this issue. So it's a very big system with a lot of parts and pieces at work, but we really wanted to look specifically at this. And again, TCHC, what they do as the lead agency is they provide technical assistance to about 50 different nonprofits in our community. They provide direct training to about 300 staff at these different agencies. They lead a strategic planning process. That's one of their federally required mandates is to do that. And they are absolutely the recipient and the distributor of $15 million of federal funding.
Okay, so why this study? You know now a little bit about TCHC, you know a little bit about homelessness. So what were we asked to do for this study? Background of this is that TCHC provides trainings to partnering agencies and their employees. They provide this on a continuous basis throughout the year, and people who provide direct services within the community can go to these trainings free of charge. They sought an evaluation to evaluate the effectiveness of these trainings, and that's where we came in to provide that kind of expertise. And they also wanted to identify factors underlying training effectiveness. So it's great and all if the trainings are high quality, but if there's an issue with actually implementing the findings of those trainings into practice, then that might be a problem. So they wanted to identify any issues that might stop the implementation of the new knowledge. Like this, okay. Okay. So why now? TCHC does evaluate their program offerings yearly to see if there are any improvements needed. They sought some improvements through this, and they wanted to be able to implement our findings in order to improve those trainings offered. And then they also wanted to figure out how best to implement their desired trainings. Okay. Also, why now? If stress in the workplace environment, you'll see in our study design that we made an effort to evaluate how stress starts to underlie whether or not trainings are actually implemented in the workplace. So if stress in the work environment impedes training implementation, then we believe from a social work perspective that that means that resources are lost and programs are thereby negatively affected. And so we wanted to look at not just what the trainings were offering, but also the kind of workplace stress that may prevent training knowledge from being implemented. Okay, so our project purpose was to support efforts to improve workplace conditions and to increase the knowledge, skills, and abilities of homeless service providers. And our research questions that guided the study are how are TCHC trainings utilized and how is knowledge from the trainings implemented? And then what is workplace stress and the work environment like for homelessness service providers? Good luck.
So, well, you just saw the last slide. So what we did for the study, and just to again kind of ground us in some basic concepts. I mean, homelessness is the lack of access to safe, affordable, and stable housing. And it can look a variety of ways. People living in shelters are considered homeless because it's not necessarily consistent housing. It's kind of intermediate for a short period of time. Obviously, sleeping outside under a bridge is not stable, safe, adequate. There's a lot of different words we use to describe it, but that was the population we looked at specifically. Homeless service providers, again, these are the folks working in agencies that provide services directly to people experiencing homelessness, of which there are about 50 agencies in Tarrant County. And then the workplace and the work environment and workplace stress, and this was kind of something that we added. And TCHC did not come to us with this initially and say, please measure the work environment. We want to know more about what it's like for our workers. Or please measure workplace stress. But that's something I've just become aware of over the years of just doing the work, but also continuing to work with agencies in the community is serving this population, as a lot of social work is difficult, it's challenging. These are folks presenting complex needs. Oftentimes the services available to them aren't resourced properly. So you're really a lot of times struggling with challenges on a lot of different levels. And so how we could best understand their experiences, we thought would be useful. This kind of group of providers, we know there's a lot of turnover. You'll actually see in our findings, we feel like we may have confirmed that a little bit. And then we also feel like there's a lot of expressions that haven't been measured systematically, but expressions of burnout. People are just saying they're just really struggling with a lot. So we wanted to try and put some numbers to that in a valid and reliable way. So what we did is we basically included kind of two participant groups, and one are the direct service providers. So these are the folks who literally provide the services in the shelters, out on the streets, in the clinics, wherever they are working directly with people experiencing homelessness. And the way we narrowed down our population, or our population pool, was we looked at folks who had attended TCHC trainings from 2017 to 18. So that's actually about 355 different individuals that we were. Another group of people we talked to who want to know about trainings and effectiveness and logistics and how to make things better was senior administrators at TCHC agencies. And we actually went out and purposefully recruited 11 people, most of them were executive directors of agencies, and then Mary, not even a TCU employee. No, she still hadn't even joined us yet. She did individual interviews with those, which actually I can go a little bit more. So kind of what we did was we did a web-based survey with our direct service providers. Fundamentally, and Dr. Twis will talk about this, we ended up with 122 valid responses, about 48% of the original pool. We actually had, I think I'm about to jump ahead, when we sent the initial email out, sent it out to the 355, we immediately got like 93 kickbacks as undeliverable. So about 26% of the emails we sent out came back as undeliverable. I thought that was really interesting, because I'm like, okay, so these people either left their job or their emails were input incorrectly, or something's going on. But then this was just last year. We did this study in the summer of 2018. So to have that many, 90, however many people all of a sudden kick back, to me that's kind of a proxy for the turnover rate that they might be experiencing. We haven't completely gone into that. That was just like a side finding. But to me that was very interesting. So we did the web-based survey with the providers. We did focus groups with the providers, and we kind of recruited them from the pool of people who actually did the web survey. And then, of course, we did our 11 interviews. So in terms of an IRB, it was quite interesting because we're doing direct interviews, a web survey. We're also doing these focus groups. So we had a lot of stuff happening. For the web-based survey, we looked at, of course, all these, we collected data on these basic, different kinds of variables, demographics, work history. For work-related stress, we use a secondary traumatic stress scale, which is, it's been used in a number of studies previously. I mean, I looked around at burnout and the different other kind of measures of similar constructs, but workplace stress, or secondary traumatic stress, what I liked about it is it actually is based on diagnostic criteria for PTSD. So it builds, the questions, there's 17 questions in the scale, and they really are built around almost what you would do if you were diagnosing someone who experienced a traumatic event. but it's more about your exposure to those as a provider, or as a, not even as a caregiver, it really is as a service provider. The work environment, we use the Copenhagen Psychosocial Assessment Workplace Environment. It's quite an acronym there. It's a pretty readily accepted and utilized measure of a work environment. The kind of questions they ask is, how informed are you of agency decisions before they are implemented? How much input do you have over the direction of your job and things like that. And then we also, in the web surveys where we ask folks to kind of rate the TCHC trainings they attended. So all of them had attended trainings in the prior year, we knew that. They all hadn't attended all the trainings, but we knew which ones they had. And so we asked them about the perceptions of the training, the utility, the helpfulness, the relevance, and then we asked them about knowledge, and then we actually asked them to talk about what did they learn and tell us some things that they remembered from the training. And then we asked them about their preparedness to work with some populations, what training needed for those populations as well, kind of around the interest in future trainings. I spoke to this, STSS. It's been used to kind of measure secondary traumatic stress, and we'll speak to this in a minute, of CPS workers, emergency department nurses, and also kind of licensed clinical social workers in different parts of the country. It's got good validity and reliability kind of measures. Say the internal consistency is very high, so probably good alpha scores and all that stuff. And then again, the Copenhagen, why we say we adopted, and this was an interesting piece of the study to me at least, is we did not use the full Copenhagen scale because the TCHC didn't like items that asked people to discuss exposure to sexual harassment, exposure to bullying, exposure to violence, and threats of violence. So those were 4 items that asked respondents to speak to their experience with those in the workplace. And TCHC asked us to not include those, which I pushed back on, and I said, I feel like these are really important things to measure, and they asked us not to. So we kind of complied with what they asked, but it still, to me, is an area that we really need to look at. Kind of the workforce demographics, if we look at them, there's potential, I believe, there for some of these things to occur. And so that was something that we really, at least we struggled with, but we moved forward with the project. My hope is that if we replicate this in other environments, we will definitely do that and really make a much stronger case for it. We did focus groups. Mary actually facilitated those, did a total of 4 focus groups. And basically the semi-structured group questions were around work-related stress. And again, just getting more feedback about the trainings. What did they like, what didn't they like, what were some of the challenges with attending the groups. Again, just to try and give TCHC as much information as we could. The individual interviews were done in person and by phone. And this was really to get a sense of, because ultimately TCHC's clients are these agencies themselves. And so TCHC wanted to know from a key stakeholder, the executive director in a lot of cases, how are we doing? What are the challenges you're seeing with implementing these trainings? What are the barriers you see to training? What can we do better? And so that information was gathered in a more face-to-face interview, but also potentially by phone as well. And data analysis, descriptive with a little inferential stuff thrown in for good measure, and then the qualitative analysis was Mary and I analyzed the data together. We felt like we had good triangulation.
Okay, so I want to start by talking through some of the study results, and I hope you can see from our discussion of the methods that we collected a lot of material, from a lot of different sources, and it really started to come together and create a really clear picture, both of the trainings that were desired and needed, knowledge retained, and I think most importantly for interest level is like the experience of secondary traumatic stress and work-related stress. And so we're going to go through all of these results. We'll kind of sweep through parts of it and then really dial in on other parts. But what I want you to know is that I will present the data by data source and the overarching theme. So you might see me kind of jump back and forth between talking about the web-based survey and the focus groups if it had something to do with, say, work-related stress. We just focus in there. So we'll start by talking through the demographics and then go into workplace stress in the work environment, and then finish with training needs and barriers. Okay, So with the web-based survey, and James mentioned that we had a 48% response rate, we found that from those who completed the survey, 80% were female, 60% were white, 80% were college educated, and nearly 40% had a master's degree, most usually in social work. They had been at their current position for an average of about 34 months, so almost 3 years, an average of 74 months total work with homeless populations. 88% of those who responded were direct service providers, so those out there in the agencies or on the streets or in the clinics. And the remaining 12% were like program managers. They were providing some supervisory work over the direct service providers. 76% of those that responded carry a caseload. So they would range from about 10 people on their caseload to maybe 50 in some cases. And 92% said that they manage their caseload at least moderately well. Interestingly, we found that the average monthly salary for those who completed the survey of direct service providers was just over $2,600 a month. What's really noteworthy about this, and we'll comment on this more later, according to Tarrant County sources, the rate of pay that's required in order to be housing secure in Tarrant County is $2,800 a month. And so these homeless service providers are receiving a wage that's below what is recommended by Tarrant County for housing security. 52% of those who responded are somewhat or extremely dissatisfied with their income, and 64% of the program managers were somewhat or extremely satisfied with their pay, so there's a little bit of a jump up between direct service providers and those in management. Okay.
So, thinking back to the STS, so again, it measures secondary traumatic stress using the DSM. It was DSM-4 criteria, so we're going to have to revise the schedule, or the scale with the new DSM-5 stuff. But 93% of our the folks who completed the measure reported at least one symptom of secondary traumatic stress in the last week. So this could be something like, it could be I avoided certain clients, or I was exposed to emotionally disturbing discussions or stories. It can also be that some of the intrusive thoughts. I had a nightmare about working with clients or things like that. So these are the things that really can disrupt someone in a workplace, but they also carry out beyond the workplace as well. So 93% reported at least one. 47%, however, based on their scores, they were reporting moderate, high, or severe secondary traumatic stress, which was almost half of the folks that we spoke to are experiencing STS at the moderate level or higher. And so that's talking about impaired functioning, not just again in the workplace, but also in their own personal lives as well. And so that was, for us, a serious finding that we highlighted with the Tarrant County Homeless Coalition. In social work, and I think in other professions, we're starting to talk a lot about self-care. We're starting to talk a lot about professional development, workforce development, and trying to ensure that folks work in psychologically safe environments. Based on the findings that we received this study, that's not happening especially well, at least in homeless services for these folks. Comparing the STS scores from our study with some scores from other studies, our folks scores were not statistically significantly different than nurses working in an emergency room or social workers working for child protective services. Work environments that I would say are pretty stressful. There's a lot going on there. The mean score of our participants, however, was statistically significantly higher than social workers working in more traditional therapeutic settings. So our folks are experiencing stress that appears to be comparable with these folks, definitely higher than folks in a more kind of clinical setting. Some other things about the work environment, just to understand the characteristics of the agencies these folks are working in. People acknowledge immediately this is a highly collaborative system. These agencies are forced to work together because the needs of the clients they're serving are so varied, and not everybody can do everything, so they have to rely on each other a lot. So 87% say they work often or very often with other folks, which makes sense given the needs. 61% of the housing case managers work with a wraparound team. And that's actually a good finding for us because providing wraparound services to folks in housing is actually an evidence-based practice. But not all agencies in Fort Worth have the resources or expertise to do that. So sometimes people in housing with a lot of needs aren't being served properly. They're not getting the kind of different levels and different types of services that they really need. So this was helpful. Still says that 39% potentially of housing case managers are not working with the wraparound team, which is a concern. And so of those, 39%, thankfully a good majority of those are saying if a wraparound team approach was available, I would absolutely do it. Some more about the work environment, just kind of understanding the day-to-day of a person in this system is, about 1 in 5 get behind in their work, often or always. About 39% often or always have enough time for tasks. They're working at a high pace, often throughout the day. And about 1 in 5 are put in emotionally disturbing situations in their work environments. And these measures in the last week. So these are kind of relatively recent experiences that they're having. And then another piece of their work is that they have to relate to other people's problems as a part of their work. So they're working a lot, they're working a lot consistently, they're hearing or being exposed to emotionally disturbing situations, and they're hearing a lot about other people's problems. I mean, again, intuitive is like, well, that's the nature of the work, it's the way it is. But thinking about the kind of load and demand this puts on an individual is something to think about. And then again, some other things about the work environment. The two things we immediately highlighted to Tarrant County Homeless Coalition is, 97% and 96% of our folks, they said their work is meaningful and important to them. So in the midst of the challenges they're experiencing, they're finding meaning, and they're finding that their work is important and that there's a reason for them to show up. And so for us, to me, kind of highlighting a potential recommendation is how do we continue to support what is a committed workforce and make sure that they have what they need to do their jobs well, because they're finding they want to. It's making sure that they have those resources. About 60% are informed of those decisions or plans in advance, and actually this is predictive of work satisfaction. It's very predictive of work satisfaction. It's feeling that things are happening around you. It's transparent. You understand what's happening. You're being kept in the loop, so to speak. Those are important. And then, thankfully, 3/4 of the folks have what they need in terms of information to do their job well.
Talking about some of the focus group findings where we dialed into the same issue of workplace stress and secondary traumatic stress. Whenever I was talking with these 4 different focus groups, it became very clear very quickly what was causing so much of their stress and what they were taking home. They described often and eloquently their high caseload. So some people talked about having 50 people on their caseload. They were trying to go to sometimes their new housing situation to try to make sure they were okay. It just sounded unsustainable over the long term for what they were telling me. They described clients in crisis. So when people are experiencing homelessness, they are experiencing a crisis, and oftentimes when they're experiencing that kind of homelessness crisis, almost everything else feels like a crisis as well. And so there's just a high energy level when working with anybody who's experiencing homelessness based upon this experience of kind of constant crisis. Bureaucratic red tape was another issue that came up really regularly. So they felt so frustrated by the fact that they had to fill out paperwork all the time. That they find their work meaningful and important, but they were spending the majority of their time filling out paperwork and trying to get people into housing when there isn't enough housing to go around for all the people who need it. And so it's just so frustrating. You're crushed on both sides by the lack of housing from the bureaucracy and also the people who desperately need housing and are in crisis seeking help from you. So for a lot of these people, they had to become the bearer of bad news to the people that they were providing services for. They also described a lot of isolation, which I thought was interesting. So they talked about working within a wraparound team, which is an important evidence-based practice. However, a lot of them were stationed maybe in clinics or street-based work and they just had nobody to talk to. They were completely on their own. They didn't have other social workers to interface with. They didn't have a lot of help from their managers or from program supervisors to make sure that they were okay. And so they described not knowing what resources were available, not knowing who to call, just feeling completely alone in their work. Going back to the web-based survey about trainings, so at least 75% of the participants strongly agree that trainings are helpful, relevant, useful, and that they can recall and apply information. And most of the participants were able to identify concepts or knowledge related to trauma-informed care, housing first, cultural competence, and critical time intervention. So those were positive findings. Further about the training and the needs that they had, we asked people, sorry. Very exciting. I'm just checking to make sure y'all are okay. So we also asked people, how prepared they were to serve these subpopulations, and also how interested they were in receiving that training. And across the board, pretty consistently, we saw that most people were prepared to serve these different populations, except when you got down to human trafficking victims. So just over half said that they felt prepared to serve these subpopulations, and sex workers was the other lowest one. So there's some overlap sometimes between human trafficking survivors and sex workers, but a lot of interest in getting those trainings. And so I think the takeaway finding here that was interesting was, these certainly are not being addressed in the training, but there's a lot of interest in that and perceived need to cover that information. In the focus groups, whenever we started to talk more about the kind of trainings that they wanted to have resource sharing, so kind of addressing that issue of isolation. They wanted to know who to call and maybe even have networking events where they could get together with other social workers and other providers in order to talk about what's working for them, just feeling like they're belonging within the service system. They also wanted some trainings on empathy, because for them, they both saw that sometimes other service providers didn't have as much empathy as maybe they thought they should, and also because they recognized in themselves when they were under stress that they had difficulty tapping into their own empathy. And they also wanted some leadership training available. So for a lot of these folks, they kind of recognize that maybe I can't do direct service provision forever, and I'd like to have some kind of way to be able to grow the skills that I need to move up into a place where I'm not experiencing the stress all the time. They desired also for the training, they wanted to have more practical application, so chances to actually practice these new skills that they were learning about. And they wanted to have the trainings better targeted to employee type. So maybe the people who are working at Safe Haven providing domestic violence services would like to have more training for human trafficking victims, or how to work with sex workers, things like that. They wanted it to be more targeted to the type of work that they're doing in the community. Okay. They were concerned a little bit about logistical concerns, so they were worried about scheduling. So how do they get away from the work that they have to do when they have 50 people on their caseload in order to actually go to these trainings? They were worried about the setting, so a lot of them felt they were asked to go into maybe kind of dangerous settings in order to go to these trainings, and that was a concern for them, especially depending on the time of day that trainings were offered. They didn't want the trainings to be more than half a day, and they wanted to have more sessions offered, so they could go at shorter length of times, and also be able to have fit with their schedules better. In speaking about the individual interviews with the executive directors, we started, is this you now? Okay. Speaking about the individual interviews with the executive directors, we saw much of the same information again, which is just really helpful for that triangulation to understand that we were seeing and really capturing what was true for these agencies and the workers. They thought that some of the challenges of providing trainings were the difficulty of identifying appropriate trainings for their staff, the difficulty with prioritizing trainings when it's so difficult to make sure that their caseworkers have enough time to do their job and get additional training, and then just the scheduling issue again. They recognized that there were some unmet training needs in terms of interagency networking, so they also saw this issue with isolation and not having this kind of really helpful collaborative of people involved. And then resource sharing again, which is much the same as what we saw within the focus groups. Okay. They felt that the barriers to implementing new knowledge and skills for their workers had to do with the lag time between learning and application. So again, the workers were asking for practice and time to actually apply the skills in the training session. And they just felt like, okay, well, it's great that we're learning about trauma-informed care, but when am I actually going to put that into practice? This lag time was an issue for them. And they also just felt that the fast-paced nature of the work, it's great to get this like little bump in knowledge and skills, but how then am I going to actually think through how to implement that into my workday? They felt that some opportunities for helping people and workers implement their knowledge and skills was to have real, hands-on practice time during those training sessions, and also the opportunity for coaching. So maybe a supervisor providing coaching whenever they left the training to go back into their community and into their work, but also the opportunity to have some coaching available from Tarrant County Homeless Coalition. So say somebody gets back out into the actual day-to-day grind of their work, and they recognize a situation for which a training, new piece of knowledge might apply, then they wanted to maybe have an opportunity for that person to be able to call a TCHC and get some coaching in the minute. Okay. They saw TCHC as being perhaps an opportunity, like a provider of training and support. Be a hub within the community for that to be offered for workers and other people within the employment spectrum. And they also saw themselves as being, they also saw TCHC as being a proactive training curator. So becoming aware of what is necessary within the larger conversations federally and statewide about homeless service provision and curating those trainings and making sure it's delivered to the workers so the workers wouldn't have to necessarily think about how to go understand all this new knowledge that's going out there and figure out how to find the trainings that they would need. Okay. Yeah.
So just some of the bigger findings from our evaluation from the time we spent is absolutely that the workforce is well-trained, they're committed, and they are experienced. I mean, to see that the majority of the folks that we surveyed had been in their current role for about 36 months, and many of them had been working with homeless populations for over 70 months. I mean, that's a level of expertise and experience that we want to cultivate and we want to retain as much as possible. Services for people experiencing homelessness are pretty complex. There's a lot of different channels to navigate. There's a lot of things to learn about the different resources that are out there, the different kinds of services and eligibility requirements. So having that expertise in the community is really important. Turnover is a challenge, and it impacts how well people are served. In the midst of these things, though, absolutely the work is challenging and it takes a toll. What the folks are experiencing, what they're exposed to in their work environments, it's stressful. And then there are characteristics of the work environment that could be improved as well. An absolutely huge finding for us was just wages. And I think it's been unspoken and everybody knows that, the majority of our folks are social workers, and it's not like that profession is known for super high wages or anything. But what these folks were making, doing the work that they're doing, it's just not sufficient. The wage isn't sufficient in any context, but especially with the work that they're doing. And this was a finding we absolutely took and highlighted in our report to the TCHC and the agencies themselves. There's a clear need for agencies to provide additional support. If you have high proportions of your folks being exposed to emotionally disturbing situations, and you know that they're hearing people's problems all day long, and you know they're working at a fast pace throughout the day, there are things that agencies absolutely need to do to create a culture of support. The idea of self-care as being the responsibility of the worker is something that I think, yes, maybe we all are in our own way responsible for our self-care, but I believe the employer, the workplace needs to be configured in a way where opportunities are made available. It's an easy way to say they just need to do more self-care, but are we providing opportunities for that in a meaningful way? Then absolutely red tape. I mean, it's constant. I mean, in a lot of social service settings, red tape is huge. But our findings confirm that we need to continue to look at processes and see if there are ways to simplify or streamline these things. What is definitely working is from the executive director interviews and also from the focus groups. I mean, people view TCHC as a community resource. It is the COCD agency. It receives $15 million a year, and some of that funding is a part of how they pay for the trainings that they provide. And they also maintain a community data management system, and so they're responsible for doing that as well. So they do play a lead role in the community. TCHC trainings are generally high quality. 75% of the folks we asked said that the trainings were useful, relevant, and helpful. And that they actually retained information. When we say that they were actually able to recount or give back to us concepts of trauma-informed care, they talked about safety. They talked about listening, active listening. They talked about physical environment. They talked about legitimate kind of concepts from the training, not just saying trauma-informed is important. They did the same thing for housing first and also for cultural competence, which we thought was really important because minority groups are disproportionately represented in the homeless population. And so having that cultural competence is important. There's absolutely a need to increase needs, however, to increase attendance. When we looked at overall at the numbers of the folks that we surveyed who had gone to some of these different trainings, they were relatively low. So while ratings are high, attendance is low. So we need to increase participation. And a lot of that tied back to the logistics. I can't get away from my 50 clients. It's at a bad time of the day. It's in a bad area of town that I can't get to easily or something like that. So we need to think more thoughtfully about where we're placing and how we're scheduling trainings. And then agencies need to support the application. I think this is something, and we'll talk about kind of TCHC's main reaction to this report, but it really is about the training just doesn't occur in one room over a 2-hour period and then everybody's good. There needs to be reinforcement back at the agency, and they're working on that. And then absolutely, I thought the resource sharing and networking findings were really fascinating. I mean, the workers, the ones we surveyed, they want to understand, they want to get to know each other, they want to know what each other does, they want to share experiences, they want to talk. I also thought it was neat that they wanted to know about the continuum of care in general. The big graphic I showed you earlier, they want to understand that. I mean, a number of them said, I'd like to understand kind of how is this bigger picture supposed to work? And then also the leadership. I thought the leadership was great. To know that folks are committed to this population, they potentially want to see themselves, I interpret it as stay in this system, continue working, but work up their way up, I thought was great. So the big takeaway for us, and some of it we just discussed, but I think, given the purpose of the study was we conducted it directly in response to an ask from TCHC. And so what they've done with the information we did is they looked at the trainings that were highly rated. They're figuring out ways to provide those more often, to kind of attend to some of those needs people have in different times of the day, different places. Maybe more importantly, though, is they're pilot testing what they're calling a case manager institute, and it's going to start this next year. And so what we did is we continued to work with them. A little bit. Mostly been me, but we've worked on actually developing a curriculum. It's been myself, folks from TCHC, ACH Child and Family Services, and some other agencies to try and develop a curriculum that touches on some of the training needs, but also does it in a way that fits with their work schedule. We've also, with TCHC, has been talking to some, so that's going to pilot I guess after the new year. They're going to initially do with 10 people. They're going to have an application process. So we're excited to see some of these findings are informing a new intervention in the community. And some other interventions are just continued discussions around pay, the wages and the work environment piece. Some of that, I mean, it wasn't a surprise to hear. The numbers were important to see, but we've known some of this stuff for a really long time. I think it's just continuing to have these conversations about how do we support the staff who are working with these really vulnerable individuals. And we want them to work in a way that where things are getting done and where people aren't being harmed, the worker or the client, in the process. So that's been another finding from the study, that big takeaway. What questions do you have?
You mentioned that 93% reported at least one symptom in the week.
Yeah.
So I was just wondering, curious, what if you'd asked like how many of you have a symptom in the previous month? And when is it a cutoff that they're going to have home for themselves to do the work that they do?
Yeah, I'm not sure. I mean, that would be a different question to ask, but. And some people criticize, one criticism of the STSS is that it may be over-pathologizing folks. Even, 40% had moderate, severe, or something. I mean, the high end of the scale. That's a lot. I mean, it's a big proportion of the population. So I've been in discussions with other folks, and we try and think about what it is to measure burnout or this other dimension, kind of constructs of workplace stress. And that's been a concern, but so I don't know, but I'm not throwing that finding out the window and saying it's not relevant. I think it's something to look at, and it puts a number, it paints a picture that I think we need to pay attention to. But as far as how it would look in a longer measurement interval, I'm not really sure. We have to do that. Yeah.
Have you guys explored or collected data on what might be protective factors from experiencing that kind of stress? So have you thought about like education level, or I don't know what else would be a protective factor, but like what are the characteristics of people who maybe aren't experiencing moderate to severe stress
That's
at
a
work?
really good question. We haven't looked at that. It is a good idea to explore what would protect against burnout, basically, right?
Yeah, I'm thinking if there's something in your educational background or whatnot that we know you could almost do preventatively, you could even look back further and say, maybe there are things we can do now for people who want to go into this work.
Yeah, I don't know if we have the variables in our current data set. There might be something to go back and look at it and put a good model together. That'd be interesting. That's great. Thank you.
Okay, great job. I think you're or more details about it. In relation to Nick's question, would you find a significant relationship between gender and race with a stress level and the wages people receive? Because that could also be part of the protective factors.
I think for this particular study, I don't think that we would have had, and this is just, again, I didn't do the data analysis for this part, but because the majority were female, I don't know that it would have worked out with the inferential statistics of a data set of 122. But I would think that that might be an impediment to running analysis on that dimension.
Okay.
I think I agree though. It's a great question. I think this is not a data set we've spent any time with since then. We moved on to other things, but I think just hearing your thoughts it's worth revisiting. I mean, we have to think of the limitations for sure, but worth taking a look. Thank you. Yeah.
Yeah, I can have a comment. So we're seeing this among teachers. They just used the STSS among teachers that they were putting in Teach for America, but then they didn't train to go into low-income schools. They kind of trained them in a silo, but then there we saw similar levels. But one protective factor they found is having support groups, right, for teachers and that coaching. So I think your findings kind of can inform those, maybe even protective factors of intervention prior to this work and help strengthen the system of support around the providers.
Yeah. And to your point, I think, even in talking with the focus group participants, so some of them described workplace conditions where they didn't ever have mental health days. There was no awareness paid from program supervisors or managers about kind of protecting that time that people need to really protect themselves. And so I wonder, is it like intrinsic, or is there a mixture of intrinsic and external factors that might be protective, and policies around providing self-care and making sure that time is protected, I would imagine would be important.
Thank you.
Thank y'all for coming.